everyone, and thank you for joining us today. We will be starting the webinar very shortly. While everyone logs on, please make use of the chat function and let us know what state you are in and what site you are from. We'd love to hear where you're watching from. Good afternoon and welcome. My name is Lisa Yates and I'm the Queensland Stroke Link Coordinator and Acting Stroke Webinar Series Coordinator here at the Stroke Foundation. Joining me today for the StrokeLine Navigator webinar are Kath Yong, and Fee Camino. Kath is the StrokeLine Manager at the Stroke Foundation, and Kath has been working at the Stroke Foundation for over 3.5 years. Currently, her role is StrokeLine Manager, managing the StrokeLine inbound and Navigator services. Kath's background is in physiotherapy, and she has worked in public hospital settings for 10 years in acute inpatient rehabilitation, GEM, and the community with survivors of stroke. Fee Camino is the Diverse Communities Project Coordinator and one of the StrokeLine officers at the Stroke Foundation. She contributes in the development of information to support survivors of stroke, their families, carers, and friends. She also works with the rest of the StrokeLine team to deliver the Stroke Navigator service. Fee is a neurology specialist nurse, and she has worked in various settings in the Philippines, the UK, and Australia. Welcome, Kath and Fee. We look forward to the presentation today. Before we begin the presentation, I'll briefly run through some housekeeping. An interactive webinar is a good webinar, so please use the Q&A function or the chat function at the bottom of your screen to submit your questions as you think of them. If you see a question that someone else has asked and you also want it answered, you can click the thumbs up button under the question to vote for it. Kath and Fee will answer questions at the end of the presentation. All registrants will receive an email with the resources mentioned and a link to the recording from today's webinar. At the end of the session, there'll be a short survey where you can also register to receive a CPD certificate. Please note that this survey will close in a week's time, so if you would like a CPD certificate, I strongly encourage you to fill it out as soon as possible. The Stroke Foundation respectfully acknowledges the traditional owners and custodians of country throughout Australia and acknowledges their continuing connection to land, water, sky and community. We pay our respect to the peoples, cultures and elders past and present, for they hold the memories, culture and hopes of their peoples. I would particularly like to thank the elders of the Turrbal people, whose country I'm joining you from today. I will now hand over to Kath to start the presentation.
Thanks, Lisa. And I would particularly like to thank the elders of the Wurundjeri people from whose country I join you today. So my name is Kath. I manage a StrokeLine service and the StrokeLine Navigator service here at the Stroke Foundation. Stroke Foundation is a national charity that partners with the community to prevent, treat and beat stroke. We stand alongside survivors of stroke and their families, healthcare professionals and researchers. We build community awareness and foster new thinking. We support survivors on their journey to live the best possible life after stroke. I would like to start with some facts and figures about stroke, some that you may already know, but stroke in Australia. Stroke kills more women than breast cancer and more men than prostate cancer. More than 445,000 Australians are living with the effects of stroke. 24% of first ever strokes occurred in people aged 54 years and under. One stroke occurs every 19 minutes and 80% of strokes can be prevented. The Stroke Foundation delivers a variety of products and services for survivors of stroke, their families and carers, including the My Stroke Journey suite of resources, Enable Me, StrokeLine, and the StrokeLine Navigator services. You may know this booklet well. It is the My Stroke Journey booklet, which comes in a kit. The main booklet now looks like the larger photo. We encourage you to provide this kit to survivors of stroke that enter the hospital, It has lots of information about recovery after stroke and the team involved. Do note that there are also other types of booklets, and I've just listed them here as well, that you can order. There is the Our Stroke Journey for Aboriginal and Torres Strait Islander people, the My Stroke Journey Easy English. My Stroke Journey is also being translated into other languages, which is FEE's Diverse Community Project, and Italian is now here, but there are also other translated copies which are coming out soon. There is also an Our Family Stroke Journey for childhood stroke and their families as well. And I've just put in where you can actually access these kits and where you can order from. And if you have any further questions about My Stroke Journey, you can also email msj@strokefoundation.org.au. I just wanted to touch briefly on the Enable Me website before I launch into the StrokeLine Navigator. We talk a lot about this site on StrokeLine Navigator. There is a lot of information on this site for recovery after stroke and on our Young Stroke websites as well, which we also have for 18 to 64-year-olds. And we also have another website, which is called the iRebound website for secondary stroke prevention. So just an outline for today. I will be talking about why there is a need for StrokeLine Navigator. What is StrokeLine Navigator? Who can be referred to the StrokeLine Navigator service and how? FEE will run through a case study. We will talk about reporting back to hospitals and evaluations and future directions of StrokeLine Navigator, and then the Q&A. So why is there a need for StrokeLine Navigator? Stroke Foundation's National Acute Stroke Audit indicates that 30% of patients don't receive post-stroke information and 35% go home from hospital without a discharge plan. On average, 88 survivors of stroke are discharged each day from hospitals across Australia. So this means that at least 26 people per day leave hospital without the materials to help them achieve their best possible recovery after stroke. From our own existing services data, we know that there is ongoing demand from survivors of stroke who cannot easily navigate the health system after leaving hospital, describing it as falling into a black hole. Survivors have told us that they are often aware that they need help but are unable to access it. They tell us that the health system is complex to navigate and that connecting with appropriate services is difficult. They tell us that they are overwhelmed by their recovery or feel hopeless and are unable to take the steps required to get help. If they are isolated or lack support from family and peers, they are less likely to access help. Some survivors of stroke also tell us that they feel that others are worse off than them, so do not actively seek support. So the StrokeLine Navigator program was developed as part of Stroke Foundation strategy for 2024 and will build on the StrokeLine service at the Stroke Foundation, which is its existing flagship inbound service. So it's built on StrokeLine. StrokeLine provides information, advice, support, and referral service to improve the recovery of survivors of stroke, their families, and carers. StrokeLine is staffed by health professionals experienced in the delivery of stroke care. And you can see that we responded to approximately 2,600 inquiries on the StrokeLine inbound service each year. This is not a large number, considering the latest data, that there were 27,000 plus Australians who experienced stroke for the first time in their lives. StrokeLine Navigator has been developed to broaden the reach of StrokeLine to deliver a consistent, high-quality follow-up outreach service to all referred stroke patients. StrokeLine Navigator will provide information, advice, support, referral, and care coordination for this vulnerable patient cohort following hospital discharge. StrokeLine Navigator will also be delivered by experienced health professionals. At the Stroke Foundation, we have two service models. The StrokeLine model is the inbound model. Clients call in or email in, and the onus is on them. The StrokeLine staff member assesses and provides an individual intervention. There is on referral and then case closure. The StrokeLine Navigator model is an outreach model. Hospitals like yourselves refer to us. We call the clients, the onus is on us. We assess and provide individualized intervention. There is on referral and case closure. So as you can see, there are similarities in these two services, and the difference is really how the person enters the service. So again, StrokeLine Navigator builds on the StrokeLine principles. It's currently in the ACT and Tasmania due to the funding that we have there. We have outreach calls, and for the ACT, this is 6 weeks after discharge. And for Tasmania, this is within 3 weeks after discharge. If you have ever heard of the STOP service in Tasmania or the follow-up service in ACT, in simple terms, these programs have been rebranded to become StrokeLine Navigator. So what do we do on StrokeLine Navigator? We build on the StrokeLine principles. We provide information, support, advice, referral, care coordination. We check that necessary appointments and services are in place. We help to navigate the system. We help to manage any changes since their stroke, post returning home, and set recovery goals. We try to empower and provide coaching post-stroke. We talk about how to reduce the risk of having another stroke or TIA. We liaise with hospital staff and treating teams when needed, and we send letters to the patient's GP post-phone call. So who is eligible? Who can you refer? Patients who are 18 years and over who have suffered a stroke are eligible for our service, or if they've had a TIA and a prior stroke, or have suffered multiple TIAs. Where the patient is unable to carry out a phone conversation, you may refer them with their next of kin as the contact person. An interpreter service is available for non-English speaking patients. Who is not eligible? Patients who are in palliative care are not eligible for the service. Patients who were admitted from a residential care home are also not eligible. And patients who have had a TIA, we encourage them to contact StrokeLine, the inbound service. So every patient that you refer in should be provided with a patient information sheet. This Word doc has information about the StrokeLine Navigator service, what to expect, and how to opt out if needed. Feel free to change the bottom of the document to include your own personal details. If you can, discuss the purpose of the phone call in detail. An example is by saying things like, once you get home, you may find you need some support or advice to help you continue your recovery. The Stroke Foundation StrokeLine Navigator service will contact you to see how you are going and connect you with services if you need them. The person calling you will be a health professional who is experienced in helping people recover from stroke. To create an online referral, there are these links which you can see on the screen and which will be sent to you as well. Do note that these are the same links as the ACT follow-up and TAS stop service. Both should now have the different heading called StrokeLine Navigator. It is an immediate and secure referral to the StrokeLine Navigator service. It's a fast form and can be saved and returned to afterwards, and a confirmation email can be sent and printed to file as well. I just wanted to take the opportunity here to thank you all for also referring into the service, because we have received quite a lot of referrals. So yeah, keep them coming through. The hospitals that we have spoken to have shared some tips for referring as well. Some have said to have a StrokeLine Navigator champion or a few, make it a regular discussion point at case conference, provide as much information as possible on your referrals. And this is very easy to say, but I'm sure with being very time poor, it can be a lot trickier. But having things such as the stroke type, the location, the medical history, as much information as you can is appreciated. And anything that is worth highlighting for complex referrals is also really appreciated as well. And just to try to educate new staff on how to refer as well. So I'm going to let Fee speak about a patient that she's worked on with StrokeLine Navigator to give a sense of what can be achieved from our call. Thanks, Fee.
Thanks, Kath. So I recently, a few months ago, had a conversation with patient X. He is a 53-year-old male diagnosed with multiple posterior circulation strokes. Based on his discharge summary, the suggestions that were made were for him to have an outpatient transthoracic echocardiogram, also to have a Holter monitor, and to have a heart bug as well. It also suggested for him to follow up with his own GP and to attend the neurology outpatient clinic once an appointment has been made with him. The Stroke Navigator call that we had was around late April. At the time, his major concerns were ongoing fatigue and feeling quite overwhelmed and feeling low, especially with his history of depression and anxiety. Physically, he was well. He felt like he had recovered really well from the physical aspect. He was independent and mobile and able to resume most of his usual activities of daily living. However, he was noticing some high-level cognition changes, which was particularly an issue for him, given that he was on a scholarship and about to start a PhD just before he was admitted with a stroke. And because of that, on discharge, he felt like he needed a fair bit of support with regard to return to work and returning to study. There was some concerns about how he was going to manage financially, given that he wasn't sure if he would be able to study full time or even work part-time, given the ongoing fatigue as well. And with the element of his past history of depression and anxiety, he was also quite worried about recurrence of stroke. Next slide, please, Kath. So on the StrokeLine Navigator call that we had, we talked through and dissected his current issues and his concerns. So I did a fair bit of assessment just to tease them out a little bit more and find out a bit more about the specifics. We also discussed each pending follow-up test and appointments that he had. And for each follow-up tests, we went through the indications for each and how to follow them up. We also talked about him benefiting from neuropsychology and occupational therapy and how to access these. We talked about available services on to support his mental health and how to access additional therapy and rehabilitation. So I told him specifically about accessing the mental health treatment plan with his GP and what that entailed. I also offered to provide him a list of available counselors or psychologists that he could see in case he was unable to access one through his GP. We offered him information about the Australian Centre for Heart Health, which had a very short waiting time, but the service would be available via telehealth because they're based in a different state. With regard to additional therapy and rehabilitation, particularly if he felt like he would, if he had agreed that he would benefit from additional occupational therapy and support with return to study and return to work, given that he'd already consumed his outpatient rehab sessions, we talked about speaking to his GP about a chronic disease management plan and accessing more therapy sessions that way. We also went through his risk factors and secondary stroke prevention, which is something that at StrokeLine Navigator we go through with every single patient. And because of his concerns about his finances, I offered to provide him information on Centrelink and even linking him with a Centrelink social worker. But at that point in time, he felt like he was going to manage. And so he actually declined, but we did say that if he felt like he needed more support at any stage, he can then call us back on StrokeLine. A big chunk of the conversation was also brief psychosocial counseling because he felt overwhelmed and just quite lost. I also liaised with the referring hospital to double check whether they had neuropsychology follow-up available. And because they didn't, we made a follow-up plan or a different plan to how to access that. As with every other StrokeLine Navigator case, we sent a letter to his GP to update him on the conversation that we had and the service that was being provided. To follow up with this patient, I also sent text messages with additional information. And as I had mentioned earlier, I offered information for how to access neuropsychology and additional counseling in psychology. So as an outcome, Mr. X, towards the end of the conversation, reported feeling less overwhelmed. He felt like he had a better idea of how to navigate the system, what next steps to take, and how to go about them. He felt like he had a concrete plan and he knew how to tackle each next step. He was very grateful for the call-in service, and he felt like he was more ready to try and return to study and return to work, and that if he didn't, he at least knew how to address it or where to get more support and help. I felt very moved at the end of the conversation when he said, "I hope you know that even though you're not in the acute clinical setting anymore, what you're doing is just equally, if not more important for people like me." It was a very rewarding moment as a health professional. Thanks, Kath. Back to you.
Thanks so much, Fee, and what you do with the service. I've just got here a little bit about the hospital reports that will be provided quarterly. Thank you for those who provided feedback on our mock report, which I sent in an email. So we've been tweaking and trying to figure out the best way to help deliver information back to hospitals. The hospital reports, I think, will now look like this. So it should show the collaboration between the hospital and the StrokeLine Navigator. The questions that hospital staff have requested feedback on seem to be whether they have provided a My Stroke journey, whether individual stroke discussion was provided, whether there was a health health and risk factor education, whether there was written info on discharge, whether the patient was involved in planning and decision making, and providing information about recovery at home. So on the hospital reports, these are questions that we will ask each patient and next of kin, and you will get percentages on each of those topics. And it's also color coordinated a little bit. So if they do say respond yes, it's a green, red is a no, and yellow is a maybe, depending on how a patient self-reports though. So the big part of a hospital report will now include what the StrokeLine Navigator does for each patient. So this is where we really are wanting to show that we're working together to get the best outcome for each patient. And we will try to provide as much information back to you. Please note that not all patients elaborate on their hospital feedback though. So some might just say yes or no, but or maybe, but we'll try to gather as much information as we can for these reports. It also includes how many referrals you sent to the StrokeLine Navigator service and how many calls were completed for the reporting period that were carried over from the last reporting period as well, and that may need to carry over to the next one too. Yeah, so just a little recap slide. So this is the way that Navigator works. So hospitals staff provide patient information summaries to the patients or their next of kin. The hospital staff refer via the link. A StrokeLine Navigator receives the referral, a call is made and liaisons occur. And GP letters are sent out once the case is completed. You will get quarterly hospital reports as well. So we will continue to evaluate the service. We have some data already, and because StrokeLine Navigator was built on StrokeLine, we have a lot of data for StrokeLine, which has been in existence for some time. So 90% of the people who contact us on StrokeLine inbound will find us helpful. 90% of those who contact us would recommend us to somebody else as well. And in terms of StrokeLine Navigator, between January and December 2022, in previous outreach services, so this is like stop and follow up, there were 642 referrals to the service in those pilot jurisdictions of Tasmania and the ACT. And the number of people who had a stroke in Tasmania is about 665. ACT was about 401 in 2020, so it's not quite the latest data. But again, I really want to thank you for referring in, because it's been great. And we have had some feedback from one of our previous outreach services in one jurisdiction that 88% said they benefited from the service. Those are the ones that we got through to. And in terms of qualitative data, Fee has mentioned in her case study, one of the quotes from the patients that she spoke to. There are also other data points here as well, which is my follow-up appointment at the stroke clinic is so far away, and it's really great for you to call and check in on me. And it was overwhelming in hospital, and I just wanted to leave as soon as I can. It's really nice to know that there are groups like you who care to follow up on us and remind us of important things. I just wanted to also say that patient satisfaction surveys will be going out after the calls as well. We're still gathering this data. And we have had a university in Tasmania who is evaluating our previous STOP program, and that is also being finalised as well. So the future of StrokeLine Navigator. Our aim is to provide a service to reach all survivors on discharge from hospital. We are keen to grow the service nationwide. This is, of course, dependent on funding. So currently it's in the ACT and Tasmania. We want to streamline the processes. So it's slightly different in the ACT with the timeframes that we call. So it's 6 weeks versus Tasmania being within 3 weeks. We want to have these more in line. And we also know that not everyone actually needs the phone call. So everyone may need different intensities. We know that we want to reach everyone. However, we need to figure out at what intensity. Perhaps a digital light touch option, such as a text messaging option, might be something to consider, or an app as well to help as well in considering going forwards. We have funding for a project officer to work with lived experience groups and find out what sorts of digital interventions would be beneficial and what type of way we can tailor this to make sure that we reach different cohorts of people. We would still want to reach everybody, but in a more tiered approach. And yes, these are my details. So feel free to contact me whenever you need. At Stroke Foundation, we are conscious not to bombard you with too much communication from lots of different people. On the ground, the Stroke Foundation has hired a StrokeLink coordinator, Lex Bull, in Tasmania, and he will be liaising with some staff in Tasmania too. And he has suggested to have one contact person in the Stroke Foundation in Tasmania. So I will leave Lex's details as well in the supporting information as well. But yeah, feel free to contact me at any time. I'm really happy to hear from you. And yeah, I'm also curious to know how much you want from me and communication wise as well. But I'll leave it there. And just for any questions, I think Lisa might just wrap up.
Thank you, Kath and Fee, for a very informative presentation. What a great service. It's just a shame it's not available elsewhere in Australia at the moment, but fingers crossed that will be the case soon. So there's no questions coming in yet. So please, if you have any questions, just pop them in the chat function and Kath and Fee should be able to answer all things StrokeLine Navigator. I'll just wait a minute to see if there's anything coming up. I had a couple of questions through the presentation, if that's okay.
Sure.
Kath or Fee, whoever would like to answer. What sort of numbers are you expecting with the StrokeLine Navigator service? Similar to what you have been getting?
Yeah, so I mean, we would love to have more referrals if possible. We had, I think it was about the 600 mark from ACT and Tasmania last year. But in saying that, there are, I think it's over 1,000 between these two states. So, you know, a little bit more would be great. But yeah, I mean, referring in as many as you can would be really, really great. Yeah.
Great. Apologies. I've just been told that the chat has been disabled, so I apologize for that. I'm turning that on now. Okay, that should be on now for any questions. I do apologize. Sorry about that, guys. I had another question. What are the main queries that you get or concerns that you have from patients when you do contact them?
Yeah, Fee, do you want to answer that one?
I think a majority of them, given that with the current hospital climate and pressures, there were conversations that were had while they were in hospital, but either it was a very busy environment or they felt overwhelmed and they might have absorbed a small percentage of it, but not the entirety of it. So just clarifying bits of conversations that they've had and just needing reiteration on several follow-up points that were already highlighted in the discharge summary, like talking about the indications for each investigation or when can they expect to receive a follow-up appointment, for example, or when does the risk of their stroke come down a little bit. So yeah, I think it's just building on bits of conversations that they had while they were in hospital, but needing clarification and reiteration because a majority of them do feel like they were overwhelmed and they didn't really absorb as much as they would have wanted to.
I think that's very common, yeah, especially patients who are in the acute phase for such a short amount of time in the hospital. There's a lot to take in. Okay, we've had a question here from Lex, who Kath spoke about, our Tasmania StrokeLink coordinator. As a clinician, I am always pleased to hear patients feeding back that they have received some education, but retention of this is always hard to glean. How well informed are you finding our patients post-discharge? I think, Bea, you probably just covered that.
Yeah, I think Kath's report should provide a better understanding of that, because she does dissect, how much of them receive health and risk factor education, and particularly in Tasmania, it goes through like how many risk factors they can name at the start of the conversation, and then after reiteration, how many risk factors can they name at the end, for example. So that's I would say probably a majority of them would be able to name one or two. Saying that yes, it was gone through, it was discussed, but just naming one or two instead of all of them. But towards the end, they are able to name all of them.
Thanks, Bea. Okay, it doesn't look like we've got any more questions coming through. So I think we'll leave it there for today. Thank you very much to everyone for their time, and also to Kath and Bea for the presentation. To provide feedback on today's session, you'll receive a CPD certificate, so please complete our survey. It should be loaded into your browser now. If it is not, we'll also send the link to the survey in a follow-up email, where you'll also receive the resources that Kath discussed through the presentation and the contact details for Kath and for Lex in Tasmania. Please remember that the survey will close at 5 p.m. next Thursday, the 6th of July. So if you'd like a CPD certificate for this webinar, you need to complete the survey before then. You can receive invitations to upcoming webinars by heading to the National Webinar Series page and subscribing to our mailing list. You'll also see a list of our upcoming webinars that you can register for. Thank you again for joining us today. We hope you enjoy the rest of your afternoon. Bye for now.